Well, it was on this date 2 years ago that we recorded the first case of the coronavirus. It was identified here in Michigan 24 months ago. And since then, we have been through so much. More than 2 million COVID cases and nearly 35,000 COVID deaths in Michigan alone. Now, today, COVID-19 cases are falling, and there is hope that we're moving beyond the pandemic. Just yesterday, the state reported 1,700 new cases for Tuesday and Wednesday. That's an average of about 870 cases a day. But as Metro Detroiters get out and about and take off our masks, patronize restaurants and theaters, there is a group at risk of being left behind. This morning, we're taking a look at what we know about long COVID and the long road and uncertain recovery for Michiganders struggling with the disease. Before contracting the coronavirus, Silver Lake resident Jeff Whitmer was active, spending time camping, grilling, and traveling with his wife and 2 kids. But in November of 2020, COVID changed his life.
Now I have to pick and choose what I do.
Jeff is suffering from long COVID and almost a year and a half later still endures crushing fatigue, headaches, a racing heart, body aches, and brain fog.
I might have a severe headache for a week and then it'll go away. But then another week, I can barely remember, what my wife told me this morning.
But the fatigue never seems to go away. And that limits his ability to go out and play with his kids and live the life he had before COVID.
It turns your life upside down. And thankfully, I have a very loving wife and kids that understand.
It is extremely impairing, frustrating, and affects the quality of life of patients.
2 years in, and Wayne State's Dr. Tina Chopra says long COVID remains one of the biggest mysteries of the pandemic. The cause is still unknown, but is believed to be a combination of inflammation and the immune system. According to Dr. Chopra, more than 80% of people hospitalized with COVID suffer from some form of long hauler syndrome. Women are twice as likely, and those suffering from obesity, asthma, COPD, and over the age of 65 are also at greater risk.
There is a ton of research that is going on at Wayne State University. Our researchers are working night and day, and they are learning more and more.
One challenge, each long COVID patient seems to have their own set of symptoms, but they tend to fall into 3 groups: fatigue, cardiorespiratory, like chest tightness and shortness of breath, and neuropsychiatric symptoms, which can include cognitive decline, brain fog, or attention deficits. With no cure for long COVID, all we can do is manage symptoms.
It is going to be a long process, and it is going to require a lot of patience, both on the part of the patient and the provider.
Ask Jeff. It took almost a year to get his sense of smell back, and he still has to rest throughout the day. He's thankful his wife and employer know his challenges are real.
You just got to be able to be open to the fact that someone may seem fine, but you don't know what they're battling and what they're dealing with.
And of course, we wish Jeff all the best. Now, Dr. Chopra says if you seem to be suffering from long COVID-like symptoms but never got tested or even tested negative, you should still see your doctor. Remember, some people remained asymptomatic and never showed symptoms even though they were infected with the coronavirus. Others may have tested themselves too soon and the tests were negative even though they too had the virus. So check with your doctor may help you get to the bottom of these symptoms and hopefully bring you some relief. But there is some exciting work underway at Thomas Jefferson University Hospital in Philadelphia. What they're doing is they're taking plasma-rich platelets, putting it in the nose to actually help people regenerate their sense of smell, and they're having some success.
Well, it's important to get those answers because you could hear his frustration, just
Yes.
the uncertainty that still exists now, 24 months out.
And that's what's most frustrating, just not knowing. If you knew it was going to be 2 years, that's
Sure.
one thing. But just to think that this could go on indefinitely really hurts.
It's great to see some progress being made there. Keenan, thanks.